Senator Pete Harckham, thank you so much for being here.
My pleasure. Thanks for having me.
Absolutely, anytime. So we did see overdoses from opioids increase in 2020 compared to 2019. It's obviously not a good situation. It's not a place that we want to be in for a state that was really making some progress on those overdoses. Do you know anecdotally why we're seeing that spike in overdose deaths in New York? I know that you've spoken to stakeholders both in the community and obviously from state agencies.
Sure, and this is also a national trend. It's not just in New York. But isolation is really devastating to people with substance use disorder. The financial despair, the stress, the isolation, the loneliness are all triggers for people with substance use disorder and other behavioral health issues where they begin to self-medicate.
So on the other side of that is the response. We are getting at least $500 million from some settlements in some opioid lawsuits, including from Johnson & Johnson and Purdue Pharma. Can you lay out how that money can be used? It's obviously a very big amount and it can make a really big dent, but how could we see that money dispersed to really help the opioid crisis?
Well, first we want to acknowledge the terrific work of the Attorney General, Letitia James, for leading the nation in these settlements. And this money will go into a lockbox that the legislature passed and the governor signed to only be used for substance use disorder prevention, treatment, recovery, and harm reduction. So first we need to start with evidence-based treatment, and that starts with the people. We have been underpaying the people in this field, so it's incredibly challenging for them to recruit and retain good people. You can have vacant beds, but if you don't have people to staff the beds, that's a big problem. The other is medication-assisted treatment. We have a waiver of prior authorization for medication-assisted treatment on the private insurance side. We don't have it on the Medicaid side. We have to have that because doctors spend 4 or 5 hours on the phone trying to get authorization. That's when we lose people. That's a dangerous time. Another thing that we can be doing is putting money towards treatment on demand in the correctional system and medication-assisted treatment. The overdose death rate for people coming out of our correctional facilities is far higher than the average population. And the reason is they still have the disease of addiction and they've lost their tolerance and they come out and they use, and unfortunately they perish at a very high rate. So we need to look out for that population. Another thing we can do is also on these crisis intervention centers. The governor proposed 10 in the budget, but there weren't funding allocations for them. These are crucial. Anyone with behavioral health issues, substance use disorder issues can go 24 hours a day. It saves on emergency rooms. It saves on the correctional system. People can be linked with treatment right away, but we've got to fund those centers. And then on the harm reduction side, things like needle exchange, A, keep people alive, and B, give them a window to get into treatment, as well as more naloxone trainings and getting naloxone or Narcan out into the population.
It almost feels like at this point in the opioid epidemic that we're almost past, like, I feel like in the start of it, people were really relying on Narcan as a way to prevent these overdoses. And now we're looking more at the treatment side of it and the prevention and how to get people to curb their addiction. And one of the ideas to do that is these things called overdose prevention centers. They're very controversial. We've seen them in other states. They're basically places that people could go to use drugs under the supervision of medical staff so that they don't overdose, and then they can be referred to treatment and services. What do you think about those, and do you think that those will be necessary to really curb the opioid epidemic in New York?
Well, I think they're vital to keep people alive, and that's the first goal. Not everybody is ready for treatment, so the goal needs to be to keep those folks alive. And I went up with a few other senators and visited a supervised consumption site in Toronto. All throughout Canada, there have been no fatalities. And it's crucial that we try and keep folks alive. So at these centers, there's also the opportunity, because they're in community health centers, where have you had a hepatitis test? Have you had a physical exam? You know, what do you think about treatment? Do you think you might be ready? So these are a way to get people into the healthcare system, and then when they're ready, to get them into treatment. And at the same time, they keep people alive. I think they're very necessary. You know, some of the critics will say they encourage use. No, they don't encourage use. What they do is people who are using already are allowed to use safely in a supervised manner with medical professionals, and you're not going to see people dying in the restrooms of McDonald's and our coffee shops.
So do we know why members of the legislature may not be on board with this? I assume that you've talked to your colleagues about the idea. I know the Senate Health Chair is supportive of it, and I don't know where they land in the Assembly, but what have you heard from your colleagues on this?
Well, I think some people are worried about some of the stigma that their constituents may feel. And, you know, around this entire field, we need to break down stigma. This is a public health issue. This is not a moral issue. This is not a criminal issue. This is a public health issue, and we need to treat it as such.
All right, well, we'll leave it there. This is obviously a problem that's not going away anytime soon, but hopefully we can see more progress made as we go on. But Senate Alcoholism and Substance Use Chair Pete Harckham, thank you so much for being here. I appreciate it.
Always a pleasure. Thanks for having me.